Hello everyone, this is Asif Khan, a registered pharmacist in Australia, a KAPS mentor and the CEO at the Dreamers Academy. Today I have my student Rashid Khan who have recently qualified KAPS exam in the March 2024. So I will ask some questions related to KAPS exam, that how to easily crack this KAPS exam. So Rashid, congratulations to you that you have qualified KAPS exam.
Thank you, sir. Thank you so much.
So you can please introduce yourself first, then I will ask some questions from you.
Okay. So my name is Rashid Khan. I have qualified the KAPS exam in March 2024, and I am the student. I was the student of Dreamers Academy.
Okay, thank you so much. So first of all, I will ask questions related to the pharmaceutical chemistry, the pharmacology. Which type of questions were present in your paper?
Okay, sir.
If you can.
So first, the paper one, that was very easy,
Okay.
and that is like most of the part that is from the pharmacology,
Okay.
and like 15 questions from the pharmaceutical chemistry part
Okay.
that were present during my exam.
Okay. And what about the paper two? Generally, how many questions were from the calculations and how many were from the other section?
So basically, from calculation, there were 15 questions,
Okay.
which I remember,
Okay.
and from these 15 questions, 4 to 5 questions that were very easy, and the other question that were a little bit tricky.
Okay.
And the rest of the thing that were from the therapeutic part as well as from the pharmaceutic part. Like 10 questions from the pharmaceutic part, and rest of the questions that were from the therapeutic part.
Okay. Can you please mention the questions? Which type of questions were present in your paper? You can take help from the.
Okay, sir. Okay, sir. I will take help from the mobile phone.
Okay.
That is like, sir, there were a lot of questions from the interaction.
Interactions.
Interaction, drug interaction specifically.
Okay.
So the question I will mention, that is interaction of simvastatin plus diazepam.
Okay.
And the next question, that is simvastatin plus clodipine.
Okay.
As well as Cipro with calcium.
Okay. What is the interaction?
Yes, either we take Cipro with the calcium containing product or not, or something like that.
Okay.
As well as there were questions from the doses as well. The doses, like the dose of hydrocortisone.
Okay.
And they also ask about the frequency of the hydrocortisone dose.
Okay.
As well as there was a question related to colchicine.
Okay.
So the dose of colchicine, that is like how much milligram, and the frequency as well.
Okay.
And as well as I will mention that the enzyme related to 3A4
enzyme inducer
and enzyme inhibitor. So I will suggest the student, I will advise the students that from starting your KAPS journey, you must go through the interaction chapter.
Okay, good.
And sir, as you mentioned related to the drug interaction, I mentioned that the drug interaction is very important. Apart from drug interaction, there were like the question from the therapeutic. In therapeutic, there were question that is the drug of choices.
Okay, medicine choice chapter.
They give me Legionella.
Legionella. Okay.
Legionella. So what is the drug of choice for this disease?
Okay.
What is the drug of something like that? That question that were part of my exam. So I will tell you, sir.
Mention the questions.
Yes, sir. Sir, the question was like the interaction between amiodarone and lithium.
Okay.
The next one, that is thyroid stimulating hormone increase or decrease in hypothyroidism.
Okay. Good.
The next question, that is the hydrocortisone dose, colchicine dose, metabolism, hepatic metabolism, that is urine acidification related to that. Metabolism depend on which type of thing, like that is, and specifically that is atypical bacteria, macrolides, tetracycline. The question, that is tetracycline, amphoteric or not. That, and the other one, that is B cell, specifically B cell, like immunoglobulin produced from which type of cell?
Okay, good.
That is B cell. As well as one question from the otitis media.
Okay.
That is disease part. Yes, sir. Exactly.
Okay.
Yes, sir. Exactly. As well as the acyclovir
Okay.
Related to acyclovir, safe in pregnancy or not.
Okay.
As well as the one question that was like from the CVS, that is I don't remember, but it was from the which of the following is used during breastfeeding.
Okay.
But I'm not sure about it.
Okay.
Specifically, and the one question that is quetiapine side effect.
Side effects. Okay.
Okay, sir. And sildenafil can be taken with nitrates or not?
Okay. Drug interaction.
Yes, sir. Drug interaction. Okay. And that is cell wall synthesis inhibitor antibacterial section. So they give me the option of like cefoxitin, cefradin, something like that. So which of the following belong to like first generation, second generation, third generation, and they give me like ceftaroline. So which of the following is used in the MRSA? Okay. So the option was like ceftaroline for myself.
Okay, Rashid. So now I will ask questions related to therapeutics.
Okay, sir.
How to easily qualify the therapeutics part, which is the 70% and the paper 2.
Sir, for therapeutic part, in my paper, there were questions like from the disease.
Okay.
Specific disease, they give you specific disease and they will ask you drug of choice for that.
Okay.
The one section in the therapeutic part that is drug of choices, and the most important one that was interaction. Specifically, I will say that drug interaction and drug food interaction that is very very important related to therapeutic part. As well as there were, as I earlier say, that drug of choices, the doses, 3 to 4 doses.
Okay.
They ask you like what is the dose of hydrocortisone, what is the dose of colchicine, something like that. So 3 to 4 questions that were from the doses. Yes, sir.
Okay. What about the OTC drugs?
From OTC drug, I think 2 questions that is present.
Okay. So which type of diseases are important? Asthma, diabetes, schizophrenia. Which type of diseases are important?
Sir, diabetes as well as the like I will say that osteoarthritis exactly. Gout is very, because 2 to 3 questions they were from the gout disease as well.
Okay. What about the adverse drug reactions chapter?
Adverse drug reaction, there were like 5 questions from the ADRs.
Okay, 5 questions.
5 questions. Okay. Because the therapeutic part that also comprises of subsection like doses, drug of choices, interaction, and ADRs, something like that. So that's why. But I must say that paper 2 is not as easy as we think.
What are the challenging chapters in the paper 2?
Interaction.
Drug interactions.
Yes, sir. From my point of view, interaction is very, very important.
Okay. So how to memorize the drug interactions? What is the reference? Which file?
The reference is like the file which you shared.
Okay.
The drug interaction file.
Drug interaction file.
Yes, sir. As well as from the PDF, the doses PDF. Also, there were like doses as well as there were some interaction, like the doses of simvastatin with ezetimibe, something like that. Is the first page of the Alanasirikal.
First page of the Alanasirikal. Okay. So, what is the last message you want to give to the KAPS aspirants? What are the tips and tricks you want to give to the KAPS aspirant? How to easily pass this KAPS exam? If someone that is planned for going to KAPS, so I will advise them that please more focus on your area, like memorizing the recall daily, as well as joining the academy. That is the foremost and the first most step to join the academy, because the academy will provide you a specific information related to specific topic. They don't go into the detail, so you have the time, you will study smart, and easily you will crack the KAPS exam. Okay, thanks so much, Rashid Khan, for your time. Thank you, and sir. I hope this video will really help the KAPS aspirant. Thank you so much.